Enter a discharge diagnosis. You will now enter your patient's discharge diagnosis. Click on the pencil in the diagnosis bar. Your patient's discharge diagnosis is atrial fibrillation. Click Add in the top left of the diagnosis problem being addressed this visit window. The diagnosis field is highlighted in yellow, which denotes a required field. In the diagnosis field, type atrial and click the binoculars to search. Select atrial fibrillation and click OK. Click OK if entering one diagnosis. Click OK and add new if entering more than one diagnosis, or click Add Problem and Diagnosis if you want to add a problem at this time. Note that the system will not allow you to enter a discharge order unless a chronic problem has been entered or no chronic problems have been selected. Complete patient education and follow-up. You are now ready to select appropriate education and to schedule follow-up instructions for your patient. Click the pencil in the patient education follow-up bar. Notice the education that displays above relates to the discharge diagnosis you entered for your patient. Double-click on atrial fibrillation. You are able to make changes, deletions, or additions to the text included in the patient education materials. You decide that you must input some additional information. Click above the text at the beginning of the instructions. You'll notice that we added the top line to the patient's discharge information. You realize that your patient needs education for wound care to appropriately take care of the incision that resulted from the pacemaker insertion. Type wound in the search field, click on All to the right of the search field, and double-click on Wound Care Easy to Read. You must complete any pertinent information. In the Get Help Right Away If section, click the interactive field and type in the appropriate temperature. You can save any of the patient education that you use regularly to your favorites. To save the patient education, right-click Wound Care in the menu above, and then click Add to Personal Favorites from the drop-down list. Click the Follow-up tab at the top of the screen to add the patient's follow-up information. Type Miller in the Provider field and click the binoculars to search. Select Miller, Ronald, MD, then click OK. From the Within drop-down menu, select 3 to 7 days as you want your patient to follow up with Dr. Miller in 3 to 7 days. Also notice at the bottom of the window, the data that you entered populates in the selected follow-up panel. In the comment panel, double-click Follow Up Post-Procedural Care, and the comment will populate to the Edit Comment section. Click OK. All information that you have entered or edited displays on the patient summary and the clinical summary. Start the Depart Process Discharge Order. You have not entered a discharge order for your patient in eCare. Remember, you can enter the discharge order prior to starting the Depart discharge process. Click the pencil to the right of the discharge order. Type Discharge in the Find field and select the Discharge Patient Order. Select the order sentence to Home and then click OK and then select Done. The Discharge Patient Order contains 3 required fields: Discharge Goals, Discharge Diet, and Discharge Activity. These fields must be addressed before signing the order. Click Sign when done. You have completed all of the appropriate steps in the Depart discharge process that applies to your patient. Click Sign and Close. The alternate way to conduct the discharge process is to select Discharge Summary on the menu. To access specific sections of the Depart, number 1, Med Reconciliation, click on the blue plus sign. Number 2, Discharge Diagnosis, click on the discharge diagnosis. Number 3, patient education, click on the blue plus sign. Number 4, follow-up, click on the blue plus sign. Number 5, discharge order, click on the blue plus sign. Click review and sign in the upper right corner when complete. You have finished the video for Intro to Patient Depart Discharge. Thank you.